I almost feel like he's talking about somebody else. And thank you very much for inviting me to Bombay for this momentous occasion when Ailesbury and Richfeel join in combination to provide a new means of therapy for the people of India. I was coming down by Miramar Point last night with Treacy, Lorraine in the car, and we passed the statue of Dr. Babasaheb Ambedkar, and I asked the car to stop for a while, and it reminded me of somebody I met in Dublin 2 months before. It was Sister Cyril from Calcutta, and she'd just been given India's highest award of the Star, and she had come to Dublin, and we'd met each other on a couple of occasions on some humanitarian projects. And she told me when she was involved with the Rainbow Project with street children in Calcutta that she had been invited to Delhi, and the Minister of Education had asked her would she extend this project to the whole of West Bengal. And when she was in the room, she noticed the photograph behind had a picture of Mahatma Gandhi with the Irish Prime Minister, Eamon de Valera. And she turned around and said, my God, how did these two people know each other, you know? And the Minister of Education said, actually, you know that India's constitution is based on the Irish constitution. Ireland was the first country to break away from the British Empire, and India was the second. And Mahatma Gandhi invited over the Prime Minister of Ireland in 1946, and together they sat and worked out the new constitution for India. Now, it's interesting, not only do we share a common constitution, our flags are the same as well. They have exactly the same colours, except you have a little spinning room that Mahatma Gandhi introduced in the flag. So not only do we share a common constitution and a common flag, but now we share a common means of hair implants that we share across each nation. And sometimes when we look at it, the flag enshrines in many ways the nation, the constitution enshrines the legislature, and I suppose our method that we're sharing in our hair implant enshrines the third most important part, the body beautiful. And I suppose when I looked at Dr. Ambedkar as well, and in many ways I look up to him because he was so innovative. He changed the behavioural thought pattern of many Indian people, particularly in terms of people thinking about the unthinkables in another way and the caste system possibly in another way. And I suppose in some ways like that, I have been as innovative in medicine and science as well. When I was 15, I was looking at plants one day and I just wondered, my God, could I influence in some way the way plants grow? So I started this experiment using different wavelengths of sounds with an audio frequency oscillator, and I got mung beans to grow 4 times bigger than they were with a particular wavelength. Around the same time, Prince Charles was in the tabloids as well, talking to plants and trying his own experiments. At the time, I suppose the British tabloid press considered Prince Charles a bit of a lunatic, but thankfully they seen me in a slightly different way, and they give me the award that year for the British Associated Amateur Young Scientist of the Year, and I met Harold Wilson. And I suppose from that period there have been many things in medicine. I remember in Mumbai in Australia, this woman came to me one day, and it was the most amazing situation. She was a half an hour late for her appointment, and she came to me actually with squamous cell cancer that needed resection, but she had told me that the reason she was late was that the police had arrested her for speeding and had pulled her over. And she told me a phenomenal story that the reason that she was late for her appointment was that she had to go to this laundry, and she had an impulse to go to this laundry about once every 3 months. And she suffered from a condition called hyperhidrosis, which I'm sure most of the doctors among you know is excess sweating. And during her wedding, she destroyed her wedding dress. As a consequence, all her wedding pictures had brown marks under her axilla or her armpits, and this had affected her psychologically. And she had gained an obsession, and as a consequence, about every 3 months, because she still suffered from her hyperhidrosis, she felt an impulse to take her wedding dress and go running with it to the laundry. And this day the laundry was closing at 5 o'clock. She was racing across to Mumbai at about 10 to 5, and she didn't make it in time. But I'd been reading in a magazine that day about the possibility of Botox being used for sweating. So we experimented with her back in 1997, and it was extremely successful. It worked within 1 day, and the first written paper that I can come across on sweating for hyperhidrosis is in Los Angeles 2 years later, in 1999. But that was a technique that we experimented with, and now it's a worldwide phenomenon. Then, I suppose some years later, we are all used to liposuction, and Dr. Klein in California had applied liposuction under tumescent anesthesia, which is local anesthetic. And we had a Vaser, which is ultrasonic guided liposuction, and I flew to the Netherlands to get a friend of mine, Peter, in Veldhuis in Eindhoven, to practice on me to see if we could combine ultrasonic assisted liposuction and Vaser along with lignocaine under just local anesthetic. We were successful, and now that's a technique that's practiced worldwide as well. When I met Lorraine, it was almost the same thing. Hair transplant was a technique that often required a general anesthetic, an anaesthetist, an overnight stay, no contact sport for 3 months, and strip surgery. And Lorraine had been working with a technique originally created by John Cole in the United States, and we applied that technique originally in Dublin quite successfully, but we noticed there were some minor difficulties with it. One was a prolonged erythema or redness in the scalp area that often lasted for some weeks, and we knew that this was related to often the size of the extractor, so we modified that to try and get as small as possible to the size of hair follicle. So we got it from 1 millimeter down to 0.7, and the erythema has dropped back to about 2 or 3 days. So in many ways, I'm not here trying to blow my own trumpet about how I've changed different things in the world, but there's a commonality among the 3 things, and that is what patients are really looking for. They're looking for less downtime, they're looking for safer techniques, and techniques that can be done under a local anesthetic. And don't forget that with a general anesthetic, and particularly for liposuction, where patients are fatter, the mortality rate runs at 1 in 3,000. Now, there's many reasons why anesthesia-related mortality exists. Number one, you're dealing with patients in road traffic accidents, so they're going to have the higher mortality. You're dealing with cancer patients. So in many ways, you would say the cosmetic surgery and cosmetic men or end of medicine is less mortality, but we're often dealing with much fatter patients who are sort of at anesthetic risk as well. And the whole, I suppose, innovativeness of using local anesthetic for all